Obesity and chronic disease rates are higher in rural communities than in urban communities. Part of it is lack of access to resources and services. Part of it is lack of access to healthy food. Our overall goal was to reduce obesity and chronic disease in rural populations, both adult men and women. And so our focus was to try to reach as many adults as we could in the two counties. The biggest gap that happens, I think, in general with everybody is they know that obesity is caused because of not healthy eating patterns, not exercising, but they don't know how to take the next step. They don't know what to do to improve their eating behavior or to improve physical activity. So we developed a multi-level intervention where we have individual groups that are running in the two counties at work sites and community locations that talk about lifestyle change. Then we have 2 health educators from the health department that go out into the community and do short health sessions to teach people, to make them aware about chronic disease, the risk factors, but to also talk about how to address them. And then finally, we have just launched a large media campaign. One of the reasons we've been so successful is we have partners who are really engaged and we work really well together. The second thing is to engage the community. I think if you want the community to be engaged, you need to go into the community and ask them what they want. While our program is focused on adults and obesity and chronic disease, one of the things that has come up over and over again is we need something for our children. We need to educate our children. We need to get this message to them when they're younger. And so as a partnership, we've been talking about, okay, how do we take this to the next level? How do we address it with children? Academic institutions and community organizations bring 2 different things to the table. Community organizations bring their connection with the community. They know what the community wants. They know who the people we need to work with are. But academic institutions bring with them the rigor of research, the rigor of implementation and planning. And so the 2 together can be a really powerful program. You build a relationship over time, and so as one grant is ending, there is always a path forward. There's always other things you can do. There are always issues with resources. There's always issues with personnel turnover. But if you have a good partnership in place, you can weather all those storms easily.